Okay, Dr. I'm ready.
Yes, Dr. Hussam.
Okay, just a second. Yeah, start, please.
All right. Hello, my name is Dr. Muhammad, one of the doctors covering the clinic today. May I confirm that you are Mr. Beckham, 35 years old?
Yes, Doctor, correct.
Yes, hi. Mr. Beckham, today I'm here to discuss your health issues and after that examine you. Is it all right with you?
Yeah, sure, Doctor.
So, Mr. Beckham, can you tell me what brought you into the clinic today?
Yeah, Doctor, I have body pain. I feel that I have pain all over my body.
I'm so sorry for that. For how long this have been going on, Mr. Beckham?
Uh, for the past 2 days.
2 days, all right. Is it the first time to get this kind of pain, Mr. Beckham?
Yes, Doctor.
All right. Can you tell me where is the site of this pain exactly?
It is throughout my body, Doctor.
Okay, all right. I see. At the moment, do you have this pain?
Yes,
Okay, I will provide you with painkillers. All right.
thank you, Doctor.
Can you rate this pain from 1 to 10, Mr. Beckham? 10 is the more severe.
It's around 5 to 6.
5 to 6. Okay, I'm so sorry for that. And Mr. Beckham, is this pain getting worse at a specific time of the day? For example, it's worse in the morning or anything like that?
No, Doctor.
So it's throughout the day. Okay, all
Yes,
right.
Doctor.
I see. All right. And do you have any joint pain specifically, Mr. Beckham?
No, Doctor, no particular joint affected. It is
Okay.
just throughout my body. I feel my muscle is aching, actually.
Okay, I see. And Mr. Beckham, is it difficult for you to stand from sitting position at all?
Yes, Doctor.
Okay. Is it hard for you to lift your hand for some time? Do you feel your muscles are
Yeah,
weak, for example?
movement in general, Doctor,
Mm-hmm.
makes the pain worse.
Okay, all right, I see. And Mr. Beckham, this is started all of a sudden or gradual?
Yeah, started to build up over hours, Doctor.
Over hours. Okay, all right. And it's
Yes.
just to double check, first time for this to happen for you, right?
Yes, correct.
Okay, Mr. Beckham, have you got recent any kind of infection recently? Any kind of illness before the symptoms?
No, Doctor, nothing significant. No.
Okay, all right. Mr. Beckham, is it better if you take a rest? Do you feel these symptoms are get a bit better?
No, I don't think so, Doctor.
Okay,
Since it started, it is just getting worse.
I'm sorry for that. Is there anything make it worse? For example, like activities, anything like that?
Actually, Doctor, recently I was very active, Doctor. I started going to the gym, doing
Mm-hmm.
aggressive um, cardio exercise
I see. All right.
in attempt to
Or,
reduce my weight.
okay. All right. And okay, Mr. Beckham, have you got any long-term medical history of note?
Yes, Doctor. Actually, I have a problem with high lipid profile, high cholesterol, and that's why
Mm-hmm.
I decided to go to the gym to
Mm-hmm.
exercise regularly so I can reduce my weight and then control my cholesterol level.
Okay. All right. We'll come to that later. Okay.
Okay.
And Mr. Beckham, have you got any high temperature?
No, Doctor.
Okay. Any lumps or bumps in your body?
No.
Any weight loss or weight change at all within these 2 days?
No, no, Doctor.
Okay. Do you feel a bit dizzy, Mr. Beckham, especially when you stand from a sitting position?
Not really, Doctor. But however, sometimes I feel that my vision goes dark when I stand from sitting position.
Okay. This is only recent, right? Within these 2 days.
Yes.
Okay. All
Yeah.
right. Have you ever lost your consciousness?
No.
Okay. All right. Mr. Beckham, what about your water work? Have you got any change in your water work? Change in color, for example?
Yes, Doctor. I noticed that my urine is getting darker.
Can you describe it for me? Is it like black tea, for example, or is it
Co
like
Cola color,
Mhm.
doctor.
cola color?
Dark cola
Okay.
color. Yes.
Okay, all right. This is within these 2 days only.
Yeah.
Okay, all right. Is it painful at all when you pee?
No, it's not actually pee to. It's not actually painful to pee.
Okay, all right. What about the amount of the water work? Is it more
Reduced
reduced?
and
Okay.
passing less water now.
Okay, all right. Mr. Beckham, have you got any kind of pain in your tummy, especially the lower part of your tummy?
No,
Okay, all right. Mr. Beckham, have you got any shortness of breath?
no,
Any coughing?
no.
What about chest pain? Have you got any chest pain or chest tightness?
I just feel pain all over my body, doctor, including my chest, shoulders,
I
legs,
see.
everywhere.
Okay,
Yeah.
okay, I see. All right. Mr. Beckham, any headache within these 2 days?
No, no,
Okay, any vision problems like blurred vision, anything like that?
no, no, no,
Okay, all right, all right. Mr. Beckham, have you noticed any kind of skin rashes?
no,
Any itchy skin?
no.
Okay, all right. Mr. Beckham, comment to that you have started to go to the gym regular. How many hours you
Yeah.
have been exercising?
Probably around 1 to 2 hours, doctor.
1 to 2 hours. Okay, what kind of exercise
Yeah.
do you do? Is it cardio?
Aerobic cardio exercise. Yes, because my aim is to reduce my weight.
Okay, all right, all right. And for how many days you've been going to the gym?
For the past 1 week.
1 week. Okay, all right. Mr. Beckham, coming to your medical background, what apart from this high lipid, what do you have any other medical issues at all?
Yes, doctor. I have also underactive thyroid gland.
Underactive thyroid. Okay, all right. For how many years now?
Not sure. Probably for 1 year.
1 year. Okay, and you have been taking your medicine for that?
Yes.
Are you compliant on your medications?
Yes, I do take my medications. Yes.
Okay, all right. And what about the cholesterol? Have you been starting any kind of medicine? Statins, you told me, right?
Yes, actually. Yeah, my GP, he prescribed to me atorvastatin,
Okay, how?
40 mg per day.
Mm-hmm.
Yes.
Okay, and you've been
Yeah.
compliant to that?
Yes, doctor.
Okay, all right. Apart from this underactive thyroid and the cholesterol, have you got any other medical issues at all?
No, no, not that I
Okay,
know.
okay. Have you been taking any kind of medications over the counter, Mr. Beckham?
No, doctor.
Okay, all right, all right. And Mr. Beckham, do you smoke?
Yes, I do smoke
How many cigarettes over how long?
around 5 cigarettes per day for the
Okay,
past 6 years.
6 years. Okay, all right. Mr. Beckham, I highly advise you to try to quit smoking because it's endanger your health. And what about
Yeah,
your
my
alcohol
GP
in?
also gave me the same advice, and I am starting
Mhm.
to quit.
Okay, all right. And what about alcohol intake? Do you drink much alcohol?
Not much alcohol, doctor. Probably just a couple of beer
Mhm.
during the weekend, especially when I am out with my friends. But it's not too much alcohol.
Okay, all right. Mr. Beckham, what kind of jobs do you do for living? What do you do for living?
But I work as a teacher.
Okay, all right. I will provide you with the sick note until we figure out what's going on with you. Is it all right?
Thank you, doctor.
And Mr. Beckham, have you got any family history of similar condition at all?
You mean muscle pain and or high cholesterol?
Yes, this muscle ache.
Um, Not that I am aware of.
Okay, have you got any family history of kidney problems, Mr. Beckham?
No, doctor.
Any heart problems in your family?
No.
Okay, all right. Mr. Beckham, may I examine you if you don't mind?
Sure.
Okay,
Okay.
I
Do you want to
want
examine?
to start with the vital chart of the patient.
So vital chart is normal. Blood pressure 100 over 60. Pulse
100
rate
over.
98.
Mm-hmm.
98, yes.
Okay, I want to start. I want to do the blood pressure system, and when he stands, is there any drop in the blood pressure?
Excellent. So there is, yes, there is a postural drop in the systolic blood pressure of 20.
20. All right. Okay. After that, I want to examine the muscles. Mr. Bickham, if you got any pain, let me know, and I'll try to be gentle. I will see the muscle. Is it tender if I press the muscles at all?
Yes, doctor, it is sore to touch, yes.
Okay, I'm so sorry for that. After that, I should I proceed to examine for myopathy or? Okay, I will ask the patient if
Yes,
there is any.
proceed.
Yes, I will do the proximal myopathy if he does have any kind of proximal myopathy in his
Okay,
upper
doctor,
limbs.
it is just painful to move my uh, any muscle of my body.
Okay, I see. I'm so sorry. Okay, so I will stop here. After that, I want to examine the.
Positive for minimal weakness, okay?
Okay, all right. After that, I want to examine the neck. Is there is any scars in his neck?
No, negative.
Negative. Is there is any swelling of his thyroid?
Negative.
Negative. Okay. The skin over his hands, is it over his body? Is it uh, d- uh, thick skin and dry and
Yeah, looks like hypothyroid skin.
okay, all right. After that, I want to examine his tummy, his abdomen. Mr. Bickham, now I'm going to touch your tummy. If you feel any pain at any moment, let me know and I'll try to be gentle. Then I will
Okay,
start
doctor.
to see
So
if there
what do
is.
you want to look for?
I want,
Mhm.
is there any tenderness to superficial palpation? Then I want to do deep palpation. I'm interested
Negative.
in the kidneys, if there is
Mhm.
any tenderness to his kidneys, any
Negative.
masses, like any
Negative.
polycystic kidneys. Negative. Negative. Okay.
Negative.
All right. Uh, After that, okay. Um, I may do just a quick neurological examination for his upper and lower
Mhm.
limbs. Is the power is reduced? Is the reflexes are fine? If there's
You want to
any,
take the knee reflex or okay?
oh
So
yeah,
reflexes
we can
looks
do
symmetrical. Yeah,
symmetrical.
looks
Okay,
symmetrical and normal. Yes.
Normal reflexes. Okay, after that, okay. Mr. Beckham, what is your concern?
Uh, yes, doctor. What's wrong with me? Why do I feel this pain all over my body? And is it affecting my kidney?
I do appreciate your concern, Mr. Beckham. I'm so sorry for what you
Two
have been
minutes
going
remaining.
through. Okay, from the history from the information that you provided me, and after I did examine you, I think what you have is we do have more than one possibility. One of them that this is because of the exercise that you have been doing for the past 1 week. This is leading to a condition called rhabdomyolysis. Don't bother yourself by the medical term. It's a condition when there is a destruction of your muscles, leading to such symptoms that you do have, leading to the soreness over your muscles, and this leading to the dark urine, dark water that you do have. And also,
Okay.
this may be related to the medication that you have been starting recently for the high cholesterol, the statins. This may lead to this muscle soreness and also the dark urine as well, or it could be both of them at the same time. Uh, for now, Mr. Beckham, we want to keep you in the hospital for some time, if you don't mind. We want to give you fluids through your veins. We want to give you some salts, and we want to do some investigations, and we'll involve a group of a specialist, including kidney physician, including a specialized nurse, and we will take care of you. Do you have any other concerns, Mr. Beckham? You did ask me, is it treatable?
I think
Yes, I do appreciate your
yeah.
concern, Mr. Beckham. Yes, it can be treated. We will do our best.
Okay, doctor.
For
Thank
now,
you.
Mr. Beckham, Yes, you're welcome. For now, Mr. Beckham, if you don't mind, I want you to hold the statin for some time until we further assess you and to know the cause behind these symptoms. All right?
Okay, doctor, we'll do that.
Yeah, all right. Okay, thank you for talking to me,
Okay,
Mr. Beckham. Mhm.
thank you, doctor. Okay, time up. Perfect timing. So, doctor, please, if you can mention the positive data in the history in
Okay, all right.
examination today.
All right. This young gentleman presented with acute history of um, muscle pain and tenderness and weakness as well, and
Mhm.
he has a acute history of passing dark urine as well after starting statins
So, what's
recently.
your diagnosis?
Diagnosis most likely it's rhabdomyolysis, either due to the excessive exercise that he has been doing or due to statins or it's a multifactorial to starting the statins besides the extensive exercise.
So, what else apart from the statin overexerting himself? Anything else?
Uh, it could be the previous history of hypothyroidism. However, the acute nature of this condition and that he has been compliant on his medications make it less likely. It could be
Okay,
polymyositis.
are you aware of any? Okay, are you aware of any other risk factors which might result in rhabdomyolysis apart from those which were positive in this case?
Other causes of rhabdomyolysis. Yes, there is other medications like NSAIDs, non-steroidal anti-inflammatory drugs, and yes,
Okay, are you sure that NSAID might result in rhabdomyolysis?
not quite sure. I think so.
Okay, so um, you mentioned that this is related to statin, right?
Yes.
So if I want you to start a different statin, which is safer in his condition, which one you would choose?
Safer statin in his case. Rosuvastatin, I think.
Okay, good. Any other option?
Any other options apart from statins or within the statins?
Any other option apart from pravastatin?
Um,
Okay, so how are you
uh,
going to investigate this patient?
All right, investigations, apart from basic investigations, complete blood count, we want to do the liver function test. We want to do the kidney function test and electrolytes. We want to do
Mhm.
urine analysis. Also, we want to do investigations to confirm the diagnosis. Ideally, by it's a clinical diagnosis, but we can do a muscle biopsy as well. Uh, yes.
Okay. Anything else?
We want also to do an ECG because it may affect his heart as well. We want to do an ultrasound of the kidneys as well.
Okay. Why ECG? Looking for what?
It may lead to cardiomyocytes.
Cardiomyocytes.
Mhm.
Okay. What else?
Ultrasound of the kidneys as well.
Okay. And why do you want to do urinalysis?
Urine analysis.
Yes. Looking for what?
Looking for is it red blood cells or is it myoglobin?
Okay. And in terms of your management plan, you mentioned rehydration. Anything else you'd want to
About
do in his case?
usually the management is supportive management for rhabdomyolysis. So yes, we want to start with aggressive rehydration, replacement of the fluids and electrolytes, and stopping the offending drug, and
Mm-hmm.
close monitoring of the kidney function.
Mm-hmm. Time up.
Yes.
Okay, okay, okay. Very well done, Dr. Riham. You did great, really. Okay, just minor comments which might not affect your score. However, if the examiner is aggressive, he might down score you in skill E. Regarding your investigation, just try to be um, a little bit more organized. Basic investigations to confirm the diagnosis, to look for the underlying cause, and to look for complication and association. Okay, and then you have, in terms of the management, you have the MDT. After you explain the MDT, go to explain acute treatment. You mentioned, I think you mentioned all the acute treatment. However, long-term treatment, you need to give the patient advice. Do not overexert yourself. Keep well hydrated. Okay. And then for now, yes, correct, you will hold the statin. However, as part of your treatment plan, long-term treatment plan, you need to recheck his lipid profile. Do we really need to continue statin? If yes, then we will select a different safer statin or other non-statin lipid-lowering medications, lipid-lowering treatment. Like what? Any idea?
There
نعم
is
نعم
monoclonal, I think, but okay.
Mm-hmm.
fibrate
Yeah.
Bravastatin.
Okay.
Pravastatin.
Bromestatin is a statin. I said apart from
Yes.
statin. Other options to lower the cholesterol, but not statin.
ezetimibe
Okay, is it my what else?
fibrate
Plizimab.
Some of the monoclonal antibodies, evolucumab. The name is evolucumab and alirocumab. Very effective in lowering the cholesterol, especially LDL, 50 to 60%. Ezetimibe will decrease the cholesterol level by 15 to 20% only. However, these monoclonal antibodies, it will significantly reduce serum cholesterol level, although it's a little bit expensive. And it is given as injection, 2 to 4 weeks. Okay, so be prepared for this question because definitely the examiner is going to ask you what other safer options you might give to lower his cholesterol level. So why pravastatin and rosuvastatin are safer compared to atorvastatin and simvastatin?
Hydrophilic.
Why? Exactly.
Hydrophilic.
Exactly. These are hydrophilic statins, so it does not enter the muscle cells and it does not, or it is less likely, to cause muscle cell damage. Okay. So, Dr. Rihan, in terms of your skills, skill A was perfect. Skill B and C, communication skills, you did not mention any jargon. Your explanation to the patient was very clear. In terms of your management plan, skill E, plan was perfect. You covered all the steps of emergency management. Most importantly, admission, rehydration, stop statin, select safer option. You detected the possible triggers. Skill G, again, you will get the full mark. You are sensitive and polite. And most importantly, in such case, you need to take care not to cause any pain or physical discomfort to your patient. Okay? This patient already, he is in pain, generalized throughout his body. If you touch the patient without asking about pain, it will be a big problem. It might affect skill G. And skill G is the last skill you might want to lose a score from this skill because the pass window is very narrow. Just lose more than 4 to 5 marks and you are done. You will fail the entire exam, not the station. So this is very important. Before touching the patient, you have to ask about pain. So, Mr. David, please, I would like to examine you. During my examination, if you feel any pain or discomfort, let me know and I will be gentle. Okay, and then proceed. This is very important. However, as we mentioned within skill E, you just need to be a little bit more well organized to get the full mark within skill E. Your investigation and management has to cover basic, investigations, basic investigations, investigation to confirm the diagnosis, look for the underlying cause and complication. Very well organized. Don't wait for the examiner to ask you, okay, urine analysis for what? No, you have to say it. Urine analysis searching for myoglobin. ECG looking for what? Arrhythmias or myositis. Arrhythmias like what? It can range from sinus tachycardia, ventricular ectopics, atrial fibrillation, up to ventricular tachycardia, ventricular fibrillation, and even cardiac arrest. And what is the most common cause of cardiac arrest usually in a patient with rhabdomyolysis? Any idea?
Hypokalemia.
Hyperkalemia.
Hyper. Okay.
Hyperkalemia. Sorry.
The muscle cell contain potassium, contain phosphate, right? When it ruptures, contain myoglobin. When it ruptures, everything will become high. Myoglobin will increase, potassium will increase, phosphate will increase. However, calcium will decrease. Why calcium decrease?
It combines to phosphate.
Phosphate.
Ionization.
Yeah, exactly. So let us try. So let us try to recap the same station. I would like to cover this scenario. I went to the exam. By the way, this scenario appeared in Dubai Center, date 3/20/23, as I remember. However, believe me, it can appear anywhere, anytime. Why? Because first, recently, according to the new PACES format, they mentioned clearly that the long clinical station should cover two types of scenarios: acute and cold cases. So recently, this seems to be the habit. They will bring one cold case and one acute case. That's why you will start to see more of acute scenarios in the long clinical station. And secondly, this type of scenarios does not need actual patient. They can bring anyone from the street, any surrogate who does not have anything, no problem at all. Okay, and then they can cook the findings. Okay, so any center can bring this scenario. So take care. Okay, it might appear again. I'm expecting this scenario to appear again within the next day. So the complaint from our side is generalized body pain in young male patient. So I will enter inside. Introduction is fixed. Hello there. My name is Dr. Tahir, one of the medical doctors in the clinic today or in the emergency department, depending on your role. Is it Mr. Beckham? Yes, doctor. So I will introduce myself. I will confirm the patient identity and then permission.